It gives hope that maybe the next generation will have less heart damage and still have the same cure rates of cancer. I'm Stephen Lipschultz, and I'm a pediatric cardiologist. Cardio is heart, myopathy is muscle, apathy is unhealthy heart muscle. I focus on cardiomyopathies during childhood, adolescence, and young adult. About 1 in every 500 young adults in the United States is a survivor of childhood cancer. And the longer that they live, the more apparent it becomes that the price of a cure of childhood cancer often is getting premature heart disease or heart and blood vessel disease. If you give as much chemotherapy, you're going to get more of a cure rate, but you're also going to get more toxicity and late effect. In the field of pediatric cardio-oncology, we've been able to develop and validate during cancer treatment ways to protect the hearts of children so that they have less long-term heart issues. We started a program that I was fortunate enough to lead where most of the childhood cancer patients and long-term survivors, we followed them, I followed them. And from this first generation of survivors, not only did it help us learn what their course was, but enabled us then, by cohorting them, to figure out what were the risk factors. And from that, we can better guide. We have found certain therapies don't cause heart problems. Others could be fatal for some children in terms of their heart. It's enabled us to tailor therapies in a more specific way to, again, improve the quality of life of that child over a lifespan. One of the things that is important is to co-manage these patients.
I think it's important for physicians to work together and to be able to speak to one another and really look at the patient as a whole. And not just from a medical standpoint, but to look at them as a whole, as human beings and children. Hi, my name is Martha Jacob, and I am president and founder of Sophia's Hope, which is located here in Florida.
Sophia, she was all about getting on with life, and she inspired everybody, and you can see where it came from.
Throughout Sophia's treatment and then with the heart failure, we met and worked with some great doctors and nurses and physicians and made great connections, but not with everyone. It was really very refreshing and encouraging when we met Dr. Lipschultz, who was just beyond amazing and kind and smart.
When any family reaches out to me or any provider, if I feel that I can contribute or offer, that's why I'm in medicine. It's hard for every family, but not every family is tirelessly dedicated to helping countless thousands of other families not go through what they went through.
We have provided over $550,000 worth of support.
If it wasn't for the timely, very directed, very focused funding, that probably wouldn't have happened.
The biggest thing that we wanted to do is the first international conference for pediatric cardio-oncology.
I've spent 40 years in this field, but there's a colleague in Brazil that spent 3 decades doing this. There's colleagues in England. We have people from all over the world coming into this conference, and we share best practices, and we determine how can we do the best. As we learn more, we know that we weren't necessarily always correct. And having the courage to honestly define reality that we learn as we go helps us do a better job.